Doc, what are your thoughts on the rising case count, and how do you think that the new Omicron subvariants might play a role in all this?
I mean, this is very, very troubling. And as you just mentioned, the reports are coming in, and it looks like our increase is 251% in Mississippi. That's actually the highest increase in the whole nation nationally. Mississippi has the highest increase over the last 7 days. What's very troublesome is we're still ranking at the lowest as far as getting vaccinated. And overwhelmingly, those that are losing their lives, those that are going into the hospital, getting on ventilators, in most scenarios, they've not been vaccinated. And then we have to remember, Mississippians, we have a very large disparity of a lot of vulnerable people in our community, people that have chronic heart disease, kidney disease, people with cancer, overwhelmingly more so than the rest of the nation. So we more than anyone need to be concerned about what's going on right now.
Dr. Quinn, we saw surges, across the South, I think the past 2 summers. Do you think this new rise in cases will lead to a major surge?
It's very possible. It's very possible. But the silver lining is the fact that now most individuals have developed some immunity. Either they've been vaccinated, which we need to get our numbers up in Mississippi, of course, or they've been infected. Because when you contract coronavirus, you do develop defensive antibodies within your body that you maintain. The level of those antibodies is not known with the infections, but is known with the vaccinations. But at least you have some protection. So what this means is the majority of individuals have some protection. So if we have a surge and a lot of people get infected, there's a higher chance that less people will lose their life. But as I said earlier, we have to think about our vulnerable population, such as our seniors, those that are 65 and older, and those with chronic medical conditions. These individuals are more vulnerable. So we have to still be on the lookout and understand that we might have to go back to masks and social distancing. And if it's determined we need to do that, that's something that we need to follow.
And Doc, Mississippi Today reports that the 251% case increase in Mississippi is the largest of any state in the nation over the past 2 weeks. How do you think that the state can overcome these challenges?
Well, what we have to do is just keep putting information out to the community. Let people know what's going on. And as I said, as these cases go up, we might have to pull back some of these mask mandates where individuals start back wearing masks to cut down infections. We might have to start social distancing more. We might have to cut down on going to concerts and gatherings where we have a lot of people together and go back to those mitigative measures to decrease this infection rate. But we definitely have to start getting our vaccinations up, getting people vaccinated. And if they're eligible for that booster, go ahead and get that booster. I got my second booster 2 weeks ago, and I'm feeling really good about it. So let's just keep informing our community, keep everybody informed, and keep everybody as safe as possible.
All right. Dr. Quinn, Timothy Quinn, thank you so much for being with us again and sharing your insight on this.